Well, hello. Welcome to Rescue Health Radio. This is Robin Fisher. Back again for hopefully a good, memorable show. It is Martin Luther King Day also, so many of you probably have the day off. Hoss, you don't have the day off.
No, although any day on the radio is a day off, because we just sit around here and we don't do anything.
Just gab.
Yeah, we just gab. Yeah, that's all there is to it.
This is my second week in the new studio. It's a beautiful studio, very radio-ish. So I'm digging it here. Just letting you know.
I'm digging it here, too.
That is perfect.
And I'm digging that you're here doing your show.
Aww.
It's nice.
Well, thank you.
You've got a good one
planned
today, too.
Well, absolutely.
Yeah.
Absolutely. I have my guest is Dr. Melissa Osborn. She's actually calling in because she's in Michigan, and as you know, we are in Colorado, which, go Broncos, you know. Everybody knows the Broncos won yesterday. Well, many people know, but anyways.
Well, they do now.
They do now. Yay. And Dr. Melissa Osborn is at the Lifetime Family Chiropractic. She's a chiropractor, and I've heard many, many amazing things about her. I'm thinking she might be on the line. I'm hoping. So, are you here by chance?
I'm here, Robin.
Yay.
Yay.
Thank you.
Very good to be here. Thank you for having me.
Well, I'm delighted to have you. Thank you for calling in.
Very good.
And even on a holiday, I don't know, you're probably always busy, but I do appreciate you calling in today. I'm excited to delve into some topics with you, but first I kind of want to hear, I think people like to hear kind of how you got started and, you know, why you're doing what you're doing.
Good. Absolutely. Well, let's see. I got started when I was a kid. I think I always knew I wanted to be a doctor, and ironically enough, when I started studying further into my many years of school, I figured out that I didn't really want to deal with medicine a lot. Unfortunately, I started studying the Merck manual and decided that that probably wasn't the best path for me to travel because I just didn't resonate well with a lot of it.
Right.
And so I decided to go to chiropractic school and college in Davenport, Iowa, Palmer, after I graduated from Central Michigan University, and yay, go Chips.
Yeah.
But after that, so we did 4 years of chiropractic school, and then started my practice, I guess. So funny how doctors always call when they play, their game is always practice. But,
exactly. That's kind of the oxymoron. It's like when you know how when you're on a plane and you go to the terminal, it's, you know, it's like,
yes,
okay.
Exactly. But yes, kind of when our journey begins, I guess, after you get all the head knowledge, you know, and then along that way, after you put all that in, then you get the opportunity to go out and see people and kind of open your heart again. You know, it's and then it's just a big journey of keeping your heart open enough to be able to serve as many people as you're blessed to be able to do. And I've been able to do that for about 7 years now, and I've had Lifetime Family Chiropractic here in Michigan for the last 4 years.
Very cool. And I've actually, you know, I've noticed, and we've talked about it, that you really work with a lot of, and if you could correct me if this is wrong, but I was reading that 35% of your clientele are kids under the age of 16. Is that correct?
Yeah. And I'm not sure that stat. We actually, it's 60%.
Oh my.
Is under 16.
Holy cow! That's
so close.
Yeah.
But we definitely see a lot of kids, and that goes from, I think our youngest patient right now she just turned a month, and our oldest patient is 94. But for the kids, it's usually under 16. So
right,
and there's quite a few.
Well, just mentioning that, when I had my first son, who's now 7, he was so colicky. I mean, and you know, you probably see these parents coming in, they're exhausted. And I'm sure you've dealt with the colic before many times, but it was horrible because, you know, they always say, well, it's this, it's that. You're not feeding him right. Well, he's just totally breastfed. So you go on the elimination diet and you do all this stuff, and colic is just a horrible thing for parents to have to go through. Lack of sleep, and he was very colicky. It was like all day. It was like for 4 months. But finally, the only thing that worked was I took him to a pediatric chiropractor, and I don't know what he did. I know he turned him upside down and did some stuff with his craniosacral type stuff. But it was the only thing that gave him and I relief. And I thought, oh, why didn't I do this before? You know? But that's seriously the only thing that worked. So I love that you're seeing kids. And I think many people might be a little nervous to take their child into a chiropractor. So what can you say to that? Maybe to, alleviate some of that fear.
Well, it's kind of interesting. First, you tell a story like yours, and you say, I've done everything. It just seems like I've kind of done this technique or that thing, and I've done this nutritional, whatever. I'm trying to work with sleep habits, all this different stuff. And then a chiropractor. Really? Like, how? I don't get it. Like, he doesn't have back pain. He's a little child, right?
Right.
I mean, he's a baby. He can't communicate that he has back pain. He's certainly not touching his back, so I know there's something wrong there. But colic is one of those things where, the baby's just mad. He or she is just trying to communicate their discomfort with the world, and this new awareness into the world of, oh my gosh, what the heck have I been thrown into? And I didn't really ask for this. And then you kind of track back a little bit, and a chiropractor will look at your son or any other individual,
right,
and will start talking to them about any trauma that's happened in their life. And in your son's case, your chiropractor probably found a vertebral subluxation in his spine, which is a bone or bones in the spine that were causing those kind of some hot wiring to happen in the nervous system.
Sounds very familiar,
so,
yes.
Your son was trying to communicate that because he's very, in his own way, just agitated and uncomfortable. And when he got that little bone, when the chiropractor moved that little bone off of the nervous system or that electrical system, then all of a sudden his body could just breathe. And his body just said, thank you. I've been trying so hard to get that off.
Wow, yep.
And the bottom line is the birth process can be the absolute first thing that can cause a lot or even just one of those little bones to cause the interference that can lead to whatever symptoms and whatever classification of a disease that someone may come in with. There's lots.
It's amazing. And I think I'm hoping today people are listening who might, have these issues and be able to resolve it a little quicker than because I felt bad, the poor little guy. And, of course, it's the selfish thing was like, I'd like to sleep any day now. But it was awesome. And, of course, you ask about, birth trauma and things. And I had him at home, but it was my first baby. He was big. And it was kind of a long process. I think it was tough on both of us. But, man, what an amazing thing that I think people really need to pay attention to, because you deserve this relief, and so does your little baby,
Yeah, absolutely.
So that's awesome. So back to, should we stay on, I want to go into some questions or talking points, but maybe just...
Well, let me respond on what we just talked about a little bit, if I can.
No, I'd love to.
It's interesting because you had this issue with your firstborn, right? And as any new mom, he's your firstborn, yes?
Yes.
Yeah. With any new mom, there's so much that comes along with being a new mom, and so much anxiety and fear and what to do's, and believe it or not, a baby is not born with a manual, right? They don't come in here you go. This is exactly what you're supposed to do every day, every hour of every day, and this is what. Step by step is what your baby will do, when they'll do it, and all of this. So a new mother, or just a mother of any sort, there's a lot of questions. And if you throw a mother, or even a newly pregnant woman, into a situation of, gosh, what am I going to expect? How is this process going to unfold? I know my belly's going to get big, and I know this baby's going to grow, but then how do I get this baby into the world as if we have anything to do with it, right? And so then this process unfolds, and you're guided so many different ways, and hopefully somewhere along the lines you listen to a radio show like this, or you talk to someone that gives you a little bit of calm or ease into that process of the unknown, if you will, and you start thinking about everything kind of comes right back to the first thing that was developed in that little baby, the nervous system. And if there's interference or, I mean, gosh, there's lots of things we're taking in all the time from our environment. So if there's ever a chance that a child could have some type of damage of any sort, whether that was the birth process. And I'm even talking to at-home moms, like that you give birth at home in a very natural, controlled environment.
Right.
That's the best way to do it. But even in those cases, I mean, I had a little baby, Franklin, that I took care of, and I still take care of, and he wasn't nursing for the first 4 days.
Yeah.
And his mom did everything natural, and she's like, what am I doing wrong?
So frustrating.
And came in to get adjusted, and the little boy, because he didn't have a sucking reflex, believe it or not. And so he started nursing just after getting adjusted, and then, from there on, it's been, the rest of the story is health. But from that type of experience to the complete opposite, which is I went in, my water didn't break, and the baby was coming, or I was induced, or whatever it might be, and then the baby was pulled on, and something from that point forward, I don't know what happened, but I know I have this baby that doesn't seem to be completely healthy, and I'm just not sure why, because I've been told all these other things, and I'm going to this specialist and that specialist and that specialist, and they're all kind of painting these pictures for me, and they're throwing words out at me that I'm just not quite aware of. I don't know what those words mean.
Yeah.
They're Latin words, for God's sake. And I just want somebody or some sort of reality that says, it's okay, and there might be something going on, but let's take care of it.
Exactly.
And let's say it wasn't even birth trauma. Let's say then the child grows and they're walking and they fall however many times learning to walk, and those little bones can become misaligned again. So there's always the potential for something like that. And then we talk about if you're able to breastfeed or not, even the potential type of toxins that can enter into a child's body prior to full development, whatever that may be.
Did you ever watch the...
There's a lot of input.
Did you ever watch the environmental working group on the 10 Americans? It's called.
No.
It's pretty dramatic, but it's about, they took a study of in utero, the infants, whatever, fetus in utero, and they tested the toxins in their body, and they came up with like 200 and some 89 toxins already before they're even born, and it was pretty freaky to me, born already with toxicity.
It's amazing that we get through this world alive, huh?
Seriously. But
oh my gosh, there's a lot. But the other part of that too, Robin, we can't put our kids in a bubble, right?
Right.
I mean, as much as we want to, the first time your child is bullied at school, believe me, you want to get in and beat that other kid up, right?
Absolutely.
But you back that up and you talk about even the bullies being little viruses or bacteria or the toxins, all of that stuff. You want the perfect little bubble for your child, don't you?
Yeah, I've had to face that recently, actually. So with my son, it's so hard, and you just got to try
realize
to.
This.
And they do have to learn. They do have to learn how to deal with those things. I think it's hard as a mom with a big heart and sympathy to deal with that. But
yes.
But it's a good example. It's like you kind of do look at them as just that little bacteria,
Right.
Exactly.
Right.
Exactly. Let's talk about the nervous system for a minute. Let's connect what you're doing, because some people they vision a chiropractor. Okay, you're going to get adjusted. How does this fit into emotional, physical illness? How, just maybe I know that's a long conversation, but just maybe a little understanding on that.
Yeah, so you're so right about that. It could be a very long conversation.
Yeah.
Okay, so the basic premise, B.J. Palmer said that vertebral subluxation can be caused by 3 different elements, and one are traumas, toxins, and thoughts. So then we all talk about the emotional and all of that. We talk about everything we're exposed to in our environment, and then we talk about the physical things that happen, right?
Right.
So the illusion is that one thing causes another, right? And that's just the illusion of life, I guess, because there's so many different things that can happen. But let's paint a little picture. So let's talk about a little boy. We'll call him Joey.
Okay.
And Joey goes to school, and he's just exposed to kindergarten for the first time. Now, there's a whole bunch of anxiety and everything else that's going into this because, gosh, going to kindergarten, he doesn't know what to expect.
Exactly.
And his parents are probably equally nervous.
Yeah, I was just going to say even more so, maybe.
And so he's got all these things coming into his nervous system, just this input of, and then these emotions that are coming out from the inside, and he doesn't quite know how to react to it. So he goes and he's gotten thrown into this environment, and things are new, and he's trying to take in all this just new environment,
yes.
and he starts to realize that he might not be as normal as he thought he was, and he might be a little different. So after weeks and months of this happening, maybe he starts sleeping less well, let's say, and they're not quite sure why. But then let's say he starts even wetting the bed, maybe, and he never wet the bed before. And you think, what is going on, right? And so let's say Mom and Dad chose to pursue this from a medical route, and not that medicine is wrong by any stretch of the imagination. What I'm trying to get the idea of here is there's a lot of choices and a lot of roads and options we can take, right,
exactly.
or go. And so let's say we go on this journey of treating the symptoms, anyhow. And so let's look at bedwetting. Why is he wetting the bed? Maybe there's some problem that's happening from, let's just say we look at every aspect besides the emotional stuff that's happening and the potential that some type of subluxation from the trauma to the nervous system, or this increased input to this nervous system, just needs to be quieted down a little bit. Right?
Right.
And so we do this, and then we maybe take a medication. I'm not even going to go into the roads of what type of medication is taken.
Right.
And then let's stay down the road. Robin.
Oh, you're there.
Oh, yep, you're cutting up there. You're cutting out. We pretty good?
I think we're good. Yeah.
All
Good.
right, wonderful.
Yeah, I
Sorry
heard the
about that.
cut
I
up
don't
for a
know what
minute. I
happened.
was a little nervous, but we're good. We're on, man.
We got
We're
a little excited.
I know.
All right. So if you track even more longer duration, and he's still not fitting in, then you start encountering more of maybe an ADHD or something along those lines. And when you start talking more and more along symptoms and all of these things, then you start trying to find a solution to those symptoms. Whereas if we kind of back up from the beginning, and now we go back into the initial thing that brought the anxiety, brought the nervous system stress on, and we start to uncover that, and then we start to deal with it in more healthy ways, let's say, by visiting a chiropractor and removing subluxation if it's there, by possibly even just simply talking to the child and finding out what's going on, or being there as support, right? And then you get to travel down a completely different road, which is the road most people, I believe, would like to choose.
Absolutely. And I think a lot of us have experienced that. I think the reason we're seeing a bit of a shift in our whole society, I mean, people are definitely striving out and looking to the non-Western type, route. I mean, there's so many different, I'm not exactly fond of the word alternative, but that's how people relate to it. They go to acupuncture, they start going to chiropractors. But that's why I think people are going different routes, because honestly, covering up symptoms is really never going to get to a root problem. And people are getting smart. There's internet, there's options, and I think we're very fortunate. We have amazing practitioners who are doing what you'd call alternative type care. And, even in my own experience, in my own family, and many people I know, yeah, it's very effective. Let's start looking at other things. Let's get to the root problem. So that's exactly right. And I know you deal with bedwetting.
I don't know if I answered your question really well with the nervous system, and I guess I wanted to give just a little bit of science behind that too, so that people understood
Perfect.
kind of the real real nuts and bolts of what is this all about. The nervous system, the brain and the spinal cord, and the entire encompassing nervous system controls everything in the body. That's its job. Its actual job is to perceive the environment and then to adapt to it. So if we have a hot stove, it's our nervous system as we touch the stove that tells us that that's hot, and then also burns in an anchor not to do that again, right? Or that reflex to pull back when that does happen. And so the nervous system, it can not only be affected by just the world in many, many forms, but it can be residually affected. I mean, there's so many things from memories, or there's also so many new things that happen all the time that need regular maintenance, if you will, right? We have to polish the most important system quite often.
Absolutely.
So I'm not sure how much detail we want to go in on that, but chiropractic oftentimes is a maintenance type, maintaining healthy. Once you get healthy, it's then continuing to stay healthy. It's a journey.
It's a journey. I like that. Our whole life is a journey, and our health is a journey, and that's what we talk about a lot here on Rescue Health Radio. I got a good visual of what you were saying. I think it brings some more understanding to just to people to understand how it connects, and maybe more people will be running off now and saying, I think we need to hit a chiropractor.
So let's talk practical stuff.
Yeah.
Right? So the practical things. So let's say somebody does want to go see a chiropractor. Let's say they have an issue and they say, but my insurance won't cover it, right?
Yes.
So maybe that there are different insurance companies that cover chiropractic, and there's quite a bit of coverage still available. And we have in our office so much of that also. But we also see a great share of people that just choose to pay for it out of pocket.
Mm-hmm.
There's all kinds of different forms, but the bottom line with all of it is if you or your child are not as healthy as they could be, then most or a lot of people want to do something about it that's proactive and take a step up and say, I'm going to take care of this no matter what. And majority of chiropractors will work with the patient on whatever practice member, on where they are and getting them to where they want to be.
Excellent. And you know what? It's the best investment you're going to make. I mean, if you think about it, and I've talked to people and they said, well, let's evaluate where not that it's a great amount of my business specifically, but where you just think to yourself where you're investing your financial, your finances. And let's see, wouldn't this kind of rate up there? What is your health or the health of your child rate on the scale of importance? It's usually number 1 or 2. So sometimes it's just a matter of switching your way of thinking and kind of allocating that to your priorities. And it's an investment in your whole life. That's how I look at it, at least. And I think people that do that same thing, they never regret it. I'm so glad I did that. And I don't even want to get into the insurance talk. It drives me insane, but, Yeah.
And you know what? It's in America anyway, I'm sure we're in very good company where people are very frustrated with insurance, and we've realized for quite some years that unfortunately it doesn't speak the language of health, and it hasn't, and it will never. So
Absolutely.
That's a completely different pocket to have to take it someday.
That's funny. Hey, Oz, I think we have somebody calling in. I hear something. Possibly. Just wondering.
No, that's actually the studio next to us.
It is?
Yeah, sorry.
And I just heard something. I thought, well, maybe that's a call-in at this point.
No, it's...
Because actually there is going to be somebody calling in that wants to give Dr. Melissa here a little hello and a testimonial, which I thought was kind of cool. So.
Oh, well, then I'll pay attention.
Yeah, pay attention over there, man.
All right.
Okay, cool. Well, until that happens, we'll, since we're talking about children and all, I want to, there's this explosion, as you and probably everyone listening very well knows, of the ADHD autism diagnosis, if you will. There's an explosion of this right now with our children all over the place, and it really leaves parents generally to seek the pill solution. What are the options? And I want to address that in your practice, because I know that especially with the percentage of kids under the age of 16, I know you're seeing this. ADHD. Oh, my kid was diagnosed with ADHD. What do we do? How do you deal with that?
Yeah, it's a great question. Most of the time, as you know, there's so many different answers for why a child has a condition, right? And everybody wants to help out and give some rational reason why this happens, because that's what we try to do. We all try to look for an answer and try to explain everything. More so than anything else, I found it's a combination of a lot of influences. A child that has ADHD or any type of hyperactivity disorder, attention deficit, or any of these labels, all too often I find that it's taking a child that might be creative or have different ways of viewing the world and trying to put them into a box of, this is the rigid way this society runs, and this is the only way this society runs. And we start that early on, from kindergarten on up, that we say this is how we do things, and that's not a bad thing. Let me make sure I emphasize that the way we do things isn't necessarily bad. It just might be different for that child, right? And so when we do that, we put them into this box, I call it. They sometimes fight, and they don't want to be in that box. And a child that's been labeled with attention
like that, by the way,
or something along these lines has a ability to be very creative and usually very spontaneous, and necessarily doesn't necessarily fit within a structure as another would. There's a wonderful book, and it's called The Wildest Colts Make the Best Horses. And I'm not sure the author of it. I apologize for that.
That's okay. We got the title. It's cool.
Yeah, it's a wonderful. And so I'm kind of getting the feedback, but there's a wonderful opportunity to welcome differences, and then to kind of celebrate the child. So from a chiropractic standpoint, and when I see children that come in with whatever it is, I'm going to tell you there's so many different labels and so many different diagnoses that come into my office. And when we see whatever that is, we really try to, first of all, clear out the nervous system. And that means a lot of different things. That's kind of it's very hard to explain that in an hour call. But clearing out the nervous system to whatever extent that might be, to get the pressure off of the nervous system. And once that's happened, then the second goal would be to continue to celebrate that child for him or herself and who he or she is. And sometimes that takes some big changes for the family. That might take the opportunity to look at different schools, or it might take the opportunity to look at maybe even homeschooling, or maybe even a little more personal attention, whatever that is. There's a lot of different possibilities, and I think from that point forward, then it's a process, and usually it takes time because it didn't show up overnight. It usually takes time to undo. A process of really just celebrating the health and who that child really is.
Awesome. And I'm sure you talk a lot about diet, and it's a whole, you put the child in the middle, and branching out all around the child is every, environmental, diet. So, addressing everything. You have to really look at everything. I had a son that was diagnosed ADHD, and a lot of it has been dietary and different things. That's a whole show worth of stuff. And then Sydney, my daughter, doesn't fit in any box. She's just she was born outside the box. So I definitely appreciate that, because I'm pretty much the same way. But we have to consider all of these things. And, I think once you start individualizing and really looking at it and not really listening to society saying this is the box they should be in, then we can get a lot farther, not only in healthcare, but just with them as individuals, Do we have a caller again, Haas? You gave me do we have someone here? Hola?
Yes.
You're here.
Hello?
Hi. Who's this?
Hi, Robin. It's Steve.
Hi, Steve. I know you.
Yes, you do, and I also know Dr. Melissa. How are you, Doctor?
Hi, Steve. Fabulous.
Do you know who Steve is,
Well,
or is
hey,
he just a random crazy caller?
I wanted to give a quick call in as a testimonial. I think that the work that you're doing, Doctor, is amazing. I feel great.
Really? So how long have you been going?
I wanted to mention this because it's only been a short period of time that I've been a patient now. My back has been bothering me for some time, and I went in, I got started on a little regimen, and already, after only a short couple of weeks, I feel great. It's actually amazed me how good I feel after such a short period of time. As a matter of fact, I was able to go back out into the woods with my chainsaw and didn't have any problems. So it's probably too early to do something like that, but I do. I feel great. So I'm all aboard chiropractic care as a whole. For many different reasons, not just for back issues as well. So
that is awesome. I'm so glad to hear you're feeling great. I kind of, you're pretty special to me, being my big brother and all. So,
thank you.
I've had everybody, well, not our father, but Mike and Mom. I've had my whole family call in now, pretty much. That's really cool. And
good.
With something really good to say.
I definitely plan on continuing to stay on the regimen here because I know once you sway, it doesn't take much, especially somebody who has had seemingly have had back problems for a long time.
I know
it's easy to fall back into not staying with the regimen and developing problems. The problems coming back again. So I'm going to stick with it because I just feel too good to not come see you, Doctor.
Yay! I love hearing. See what a difference you're making, Dr. Melissa? This is awesome. And Steve knows.
Well, we have wonderful Steve here.
Yes. And with your beautiful children, you can also take them to Dr. Melissa. You got a whole package deal here. It's awesome.
It's nice. I go in there and, I see all these families in there with the young children and, she does the adjustments out in the open so that the families can see and be with the kids, and it's a wonderful environment for the whole family, definitely.
I get that feel just from looking at the website and, just talking to, before when we talked on the phone, Dr. Melissa, and just the feel. You can kind of get the aura of this is a safe, comfortable environment. And I haven't even walked in the office, but, you can tell. You can tell immediately when you walk through a door. So I love to hear that. And I'm so glad you're feeling good, Steve. You better keep up on this. I'm going to be on you.
I will. I'll be looking forward to seeing you this afternoon, Doctor.
Great.
All right. Wonderful. Thank you.
I'll make sure to get her off the show on time so you can make your appointment. That's all good.
There you go.
Okay. Nice talking to you, Robin. Bye-bye.
Bye-bye. Love you. That was a nice family moment, wasn't it?
It was beautiful. Yes.
Well, I didn't know he was going to plan that, and I gave him the number, and I said, hey, then call in. Always if you appreciate somebody and they're making a big difference in your life, let them know. You never know if it's going to be your last day. You just don't know. So I'm glad he told you that, and I'm sure I can't even imagine the countless people who you're changing lives for. So thank you for what you're doing.
Thank you.
Yeah. Really, you're in your element. You're doing what you should be doing. That's beautiful. I don't know where we were at when he called. I wasn't.
Well, let me kind of touch on something because when Steve was talking there, somebody might have brought up the question of what does the regimen mean and what is the staying on track? What is that all about? Like, let's say I choose that I want to go to a chiropractor. I want to take my child to a chiropractor. So is this something that's going to have to be like a lifelong commitment, or, once I start going, am I always going to have to go? And all of those things, kind of come up in our minds like, oh, I don't want to start anything that I'm not ever going to be able to quit, or get out of, or any of that.
That's a good point.
And one of the big things that Steve was talking about there, and a lot of times what happens is when a person has, let's say an adult starts care, and they've had an issue for quite some time, or even a short period of time, there's usually a key time where that injury or something started. And so when we start out taking care of someone, there's a process of corrective or initial type intense care that needs to uncover and take care of the problem and then keep it gone, or get it gone anyway so it won't come back. That's the big thing. And then after that, then we start looking at deeper things, and we start looking at uncovering more and more health, as well as the regularly maintaining anything that encounters that person in life. So as far as once a person starts care, if they always have to go, that's never the reality. Even if a child, let's say your child has colic, like in Robin's case, and you bring your child into a chiropractor and say they are taken care of and the colic is gone, it's always your choice what you do. Now, you'll always be presented with the opportunity to say, did I just want chiropractic care to take care of this, whatever it is, whatever that initial reason for going into the office is, and you're welcome to discontinue at that time. That's always an option.
Sure.
A lot of people, more and more all the time, are choosing to stay on and to keep regularly maintaining their spine and nervous system so that they can continue along the health journey, similar to as if you were going to a gym, right? You start out going to a gym and you think about, I want to lose 10 pounds, and that's my goal. So I'm going to start out working out, and once I lose that 10 pounds, you can quit that gym. That's okay.
Sure.
I can say that,
the
right?
10 pounds are going to come back on, but probably.
It can come back on, or you just won't get to that next level, and then maybe a bigger, deeper goal of overall health.
Are we having glitches again? What's up with the glitches today on the radio? Are you here still?
I did. I heard the feedback.
Yeah. Sorry about that. I've never really encountered this unless somebody Skyped in. You didn't Skype in, so that wasn't I don't know. Okay, anyways. Where were we? You were there. Let's talk about emotional stuff. Are you here, Dr. Melissa?
Yes, I'm here.
Great. I don't want to lose you yet. Jeez. Now, this is kind of going back on the what we mentioned with the ADHD stuff, but these emotional diseases that are really ravaging our population, like depression and stuff, again, we're going back to really the nervous system and everything, but are you seeing more and more people that are having emotional problems versus physical, or, a good balance there?
Yeah, so, Robin, I'm still getting a lot of feedback.
Yeah, I don't know what the deal is.
There's no feedback. Doctor, there's no feedback on our end, so just keep talking. If you're on a cell phone, I don't know if you're moving around. That almost...
No, I'm on my...
You're what?
I'm on my office phone.
Okay,
so.
All right, well...
But there we go, it's a little clearer now.
Okay, you sound fine, though. Keep going.
Yeah.
Okay, yes, sir.
Sorry about any trouble here. Okay.
That's okay. So for the emotional side, it becomes a little more difficult to start talking about emotional issues, if you will, because one of the first things that someone does is they kind of fight against that right away, right? Because a physical thing we can see, we can feel, we can use our senses to grasp it, and so that's kind of it's a easily attained understanding, I'll say. And so physical stuff, you don't really get a lot of resistance or a lot of fighting with. But you start talking about emotional stuff, and yeah, there's a lot, obviously, deeper root to emotional manifestation of any disease or whatever that is. And so in that case, let's talk about depression. You talked about depression. There's a lot that goes underneath the surface, and depression can show up as a lot of different things, right? A person, for instance, can have not really a great understanding that they have depression for quite some years until physical signs or symptoms show up, or they actually go in and say, hey, I've got this issue, and then they're diagnosed as being or having depression. And it can come in kind of a rude awakening. So the emotional side of let me say, it's impossible to have any illness and not have an emotional side to it.
True.
Okay, can we say it that way?
Yeah, I think perfect.
Yeah, does it mean that you have to sit back and go to 100 hours of counseling? No, it's not weird. It's absolutely 100% normal to have any emotional backing to whatever it is that a person's experiencing.
Exactly.
And I think that's the first line that most people have to kind of be invited into, is to understand that everybody has their set of junk, right? We've all got baggage, and we've all got something that lines our lives. And if we can just start by acknowledging it first, that's a huge big start.
Huge. I think in society it's the facade of mental, that person's mental, whatever the statements they want to make. But I think that's kind of going away at this point. We don't have as much fear about, there is fear, but not as much fear about, those diagnoses. I hate labels. I really do. I'm just going to put it out there. I hate the label. But everybody, especially in Western medicine, has to have a label. You could look at ICD-9 codes and all that. You are this, you are that. You have to come up with a label or a diagnosis. And that's kind of tough for me. I've always had a hard time with that. I really have. Because it's putting it in a box, once again.
Absolutely.
And the problem with that is that, your strong allopathic thinking would be, then they got to follow this mapping. You're diagnosed with this, so now we follow, regardless of what else is going on or how individual, without being individualized, I should say, we got to follow this map, this protocol. And that's also tough for me. I mean, being in healthcare for so long, and I've had a rough time with that, because you know what? It doesn't always apply. In fact, it applies it might give a guide, but that's about it. It sticks you in a box.
And so one of the emotional things that we see a lot, too, is the inability for someone to trust someone of, just say, the doctor-patient relationship, right? One of the biggest foundations for the doctor-patient relationship is trust.
Right. And
being that you have someone that you can count on and emotionally be able to, even if it's for 2 seconds or if it's for 2 hours, but you know that someone literally has your back. And in this case, he has your back, right?
Right.
But they definitely, every person from an emotional standpoint wants to be loved and wants to be heard. And once those things are taken care of, and then, hey, let's take care of all these ailments on a physical and whatever else plane that's going on, it's an amazing outcome. And the reason why you talk to a lot of chiropractors or even chiropractic patients, and they rave about their chiropractor and all this miracle that happened and that wonderful thing that happened, because they happen all the time, is because the person is on an emotional level. I think a huge reason is an emotional level able to trust another human being with their overall health, and it's huge. Maybe it's the first time in years or whatever they've been heard.
That is such a good point. Enormous. We talked about a few weeks ago about the patient's story, meaning, gathering trust and really individualizing. And I always tell my nursing students that I have when I teach that what is the one thing people want more than anything? And everybody jumps on the whole textbook thing to do this, that, and the other thing. It's no, they want to, for one thing, they want their dignity. What can we do to make sure that to maintain their dignity and trust? It's just my ongoing talk and discussion with them. And it is so true. And what's hard now, the way the healthcare system is set up, is and it's not a bash against anybody, because these practitioners have a strict regimen and they have to follow. But when you have one hand on the door handle and the other on the prescription pad, it's a really hard thing, in 6 minutes to establish this rapport and this trust. It's huge. It's the biggest component. You could, and I tell even the students again, you don't have to know everything and get the straight A's in school. But if you can show them that you care and establish this rapport, they're going to love you regardless, And it's important.
I think you'd be pretty hard-pressed to find a person that chooses health care, hopefully, without the dimension of love for people and wanting to serve and take care of people.
Exactly.
You know, that's something that usually drives a person into this field of care, no matter what it is. And as long as that can be maintained and not forgotten along the way, or hurried out of, or pushed out of any of that, and I love what you're doing from the teaching aspect of that.
Thank you.
That is foundational, and if you can remember throughout any journey in health care is just to love and to serve. You can't go wrong.
Absolutely. It's your virtues. We've been talking about virtues a lot, too, on this show. On that, actually right on the line of trust and everything, how could we recommend somebody to find, I always say we'll interview them and all this, to find somebody. We'll use chiropractor because you're a chiropractor. We could use this in any context with any practitioner, but what's the best way to advise somebody to find, someone they can trust?
Yeah, so it's difficult the deeper whatever issue is the person has, right?
Exactly.
Because you even need more trust. Like if you have something relatively new to, or you are not as emotionally involved, then it's a little easier. But so when you look into finding a practitioner, whatever that is, a chiropractor, let's say in your area, one of the best ways to go, I find, first is ask your friends and family.
Mm-hmm.
That's the first place.
Word of mouth.
It is. And they don't lie. They they can't lie very well, and they usually have no incentive to send you to someone other than the fact that they absolutely love and care about you and possibly the person that's taking care of them. Hopefully the person that's taking care of them. And the second way, that if that's not a great option, or maybe it's a new thing or whatever, the next way is to look online and find, just like you were just talking about my website, the internet is such a vast amount, has got so much knowledge and things that we can put in so many different ways and different resources. Go to the internet and ask your friends there, right? Facebook, is asking, hey, who knows of a chiropractor in this area?
Mm-hmm.
And then once you find that person, research them a little bit. Try to do some background checks almost. Look at their website. Look at their office and see if it's something that would fit you. I obviously see a lot of children here, and so someone that doesn't like children probably wouldn't want to come see me.
Yeah, 60% of your patients, I would think that you like children. I have a feeling you like children. Actually, I have a feeling you like many people, and like Steve, just like what you're saying, Steve wouldn't lie. He definitely wouldn't have called in. He's never done that before, but, if you know your family and friends, obviously, and most people do know their family and friends, take their word for it. There's some truth to that, for sure. Before wow, I didn't realize how fast the time is going by, but I have a couple of questions from audience people, and I wanted to ask you, if you don't mind. This one's from a Dr. Jeff Perstupa. He wants to know, Dr. Melissa, do you feel it necessary to offset the toxicity of vaccinations with herbs, oils, enzymes, etc.? What do you recommend? Good question. Interesting.
Yeah, also a difficult question for me to answer.
I think it probably is.
Yeah, that's. I wish I could say that I had the perfect. This is the one that would work the best. It's really kind of out of my scope. But I will tell you. How do I answer that?
You don't have to answer it.
Yeah, maybe I'll just let you do that one, Robin, if you will.
Yeah, we talk about that kind of stuff quite a bit. That would actually be, I'm actually doing a whole series of shows with different people on vaccinations, and it starts in a couple weeks. It should be rather interesting because, there's going to be many different views, many different, facts pointed out and things like that. So that, I agree with you.
Robin,
that's a long show.
I didn't hear the first part of the question. Did you say how do we choose not to vaccinate, so how do we offset that? Was that the question?
Actually, it sounds like it's a post-vaccination. Like, do you, the offset, the toxicity afterwards, it sounds like, or the toxicity of vaccinations. Basically,
got it. Okay. I'm so sorry. You're kind of cutting out. I wasn't able to hear you clearly with that. So let me review. Let me back up a little bit. So from a whole vaccine standpoint, let me just say it this way: everything is my opinion and my choice. Right? We choose not to vaccinate our children, and in saying that, there are a lot of people that are very heated with this subject. The vaccine itself is the principle behind it is to take care of an illness, whatever that might be, right? So
it doesn't exist.
Polio or measles or any of those things. We could go on for an hour discussion about why not, all that.
Yeah.
But let's say a person has already chosen to vaccinate. Now, after that, what you really have to work to combat are all the preservatives and everything else that was inside that same vaccination.
Detergents, neurotoxins. I can add that in. Sorry.
Yes, and all of that. So when you look to undo that from a chiropractic standpoint, what we look at is those are toxins to the body, right? Those are toxins to the nervous system. So when we look to undo those toxins, if that's possible to any great degree, then we slowly and surely start to uncover layer by layer whatever damage that did to the body, to whatever we can do. I mean, there's so much controversy with that. I mean, that's very key in autism and all of those things. Not to say that there's only one cause of autism. I'm not saying that at all.
You're right.
But vaccines it's a heated subject, and I was vaccinated when I was a child. My parents didn't know any better.
I was too.
And we've made a different decision.
Well, but we've also only had 8 vaccinations when we were children. Now there's about 50-something.
Big difference.
Big difference. There's more additives, too. The vaccinations shows will be very interesting. I've been digging way back in history, and there's a big difference with what is now put into them as far as the preservatives, the neurotoxins, the detergents. So it's going to actually be a really interesting series, and I also have not, my kids have never had a shot in their life, but, you can get in quite some heated arguments with people, for sure. But I have another question that is, it's really interesting that I'm getting questions for you that are all related to this. This one's sad, but if you're ready for another question, I'll ask you.
Absolutely.
Okay. My child developed Guillain-Barré within a day after vaccinations. Can chiropractic help? And I'm so upset and desperate.
Oh.
That makes me sad. I'm so sorry.
That's a very hard, way to start for that. First of all, I want to say I'm sorry, and I feel that you like for that go through some of that. It's never easy to know that you made a decision or feel like you may have been forced on and then have to pay a price like that afterwards, right?
Right.
So can chiropractic help a child after that? And my answer is a absolute yes. The question can't really ever be, can chiropractic cure my child of this thing that was caused by a vaccine? Because let's just be completely honest, chiropractic doesn't cure anything, right? Mm-hmm. We remove the subluxations that cause the body not to function well, and that's what it is, no matter what you, however you try to say it. So when a child has been injured by a toxin, then chiropractic works in the way to try to rid that toxin from the body, if that's possible. And we're never given the opportunity to understand how long that's going to take. Sometimes it's one visit, sometimes it's a couple of years, and sometimes it just doesn't happen at all. So these are hard, and that's always the hard part you get to when a choice is asked to be made that's kind of uncharted territory. I mean, that particular person didn't have that experience going into the vaccination, so there was almost zero fear of that happening.
Sure.
And then as soon as it did happen, now you can that a vaccine will never touch another person within a 400-mile radius of that person. So can chiropractic help a child with that? Absolutely.
I would say go for it.
It's just very hard to say what level.
Exactly. That's a tough situation. I'm sorry for that, listener. It's heartbreaking.
We're facing that all the time with autism and various other syndromes, right?
Yeah.
I mean, there's a lot of that particular story that's told.
Absolutely.
A lot.
Yeah.
I don't know if people are aware of it, too, but there are actually two different courts, Supreme-type courts. One is for vaccines and vaccination injuries, and one is for just mainstream. And it's really profound how many injuries are happening through things like toxins that are in vaccines.
Yeah. Yeah, I'm looking forward to delving into this series. I've got a lot to say about it, but this wasn't the show to do that. I think we touched on it enough, a little bit to, what I always say is I want people to be proactive. I want people to question and do your own research and go with your gut. And I think, you're going to make the best decision for you and your family based on how you feel and what you're doing. And I think we also need to support that. One of the biggest things that I tell students, again, or anybody, is that people will not generally make a decision just to be spiteful or say, this is a bad decision, I'm going to do it because it's going to cause harm. People do not do that.
Right.
And we need to be conscious of that, because whatever repercussions come out of a decision, they're going to have to deal with it and have some discomfort, maybe a lot of pain. And who is it for us to ever place a judgment or a blame on anyone? So really be supportive in this, and maybe different choices will be made after that, and maybe we can help you get to those choices. But it's one of the biggest things I kind of just drive into people. And I think you made a good, you also in different ways that we're saying that too. So I appreciate that. But do you have any last minute words that you would like to say? And there are listeners in Michigan. I'd like you to give some contact information if you are taking new patients. That would be a great. If not, that's okay too. But if you want to put it out there, then now would be a good time to do that.
Sure. Yeah, we're actually taking patients right now. Our phone number is 810-588-6314.
Great.
And we can be found on the website at brightonlfc.com. So in Brighton, Michigan, Lifetime Family Chiropractic. I guess some last minute words that I could try to offer are, I've been at this for a little while. I'm a mom of 3 kids, and I have been practicing for, like I said, almost 7 years now.
Mm-hmm.
And 8 years now.
Wow. Congrats.
Thank you. But, I think the biggest thing that I've found, just the life experience, is people are people across the board, and we can all educate ourselves to the hilt, which is very important, and it's very, very wise to have the education behind whatever we do and whatever choices we're going to make. But, one of the things I always tell people to try to listen to is your heart and that gut feeling.
Yeah.
Whenever you're going to make a decision, whether that be health for you or your family, and let's just be honest, women make most of the health decisions in the family, right? So listen to that gut, that feeling, that intuition, whatever word you want to put on it, but listen to that voice inside that says yes or no, and really try to listen. Don't try to over-educate that feeling, or don't try to under-educate it, or whatever it is. Just listen to that, whatever that thing inside of you that tells you what right and wrong is, and you can't go wrong. You really can't.
I agree.
And if you can sit definitely listen on a long enough basis, eventually you'll find the answer you're looking for.
I love that. That is the best way to direct your whole life. That is the best way to end this show even. But Dr. Melissa, I'm sure maybe I would be blessed enough to have you on again sometime. An hour just flies by. But again, Dr. Melissa Osborn at the Lifetime Family Chiropractic in Brighton, Michigan. And thank you for your time. And I think that we could go for hours on these topics. We just kind of touched on them, but I think now people might have some, maybe even of their own questions they can start researching, or maybe it's time to consider some different alternatives for yourself, your family. And thank you. Thank you very much.
Thank you, Robin.
Thank you. Have a blessed day.
You too.
And everybody
Bye-bye.
listening, bye-bye. Everybody listening, thank you for listening. We'll be back, of course, next week with more intriguing topics and thoughts. And our series is coming up in a couple weeks. Actually, we're going to start doing more series for this show. So I'll start announcing what those things will be. And I'll post and all that good stuff. So thank you. Have a great week. Happy Martin Luther King Day.
Try to take the path less traveled by. That first step you take is the longest ride. If today was your last day and tomorrow was too late, could you say goodbye to yesterday? More stimulating talk radio. MileHighRadio.com